Hey guys, I'm Gursimran Singh Arora, a physiotherapy intern, and you are watching PhysioMechanist. Well, in this video, I will be discussing on the topic shoulder joint. So, what is shoulder joint? Shoulder joint or glenohumeral joint is defined as an articulation between the head of the humerus and glenoid cavity of the scapula. So, from the diagram, this is humerus, this is head of the humerus, and this is glenoid cavity of scapula. So when these two articulate, it forms glenohumeral joint. So glenohumeral joint is a synovial joint of ball and socket type. Since it is ball and socket type of joint, then it means it is multi-axial in nature. By multi-axial, we mean that it can produce movement in different planes and around different axes. So uh, there is difference between shoulder joint and shoulder girdle. Shoulder girdle is a larger term and it includes different joints like uh, like acromioclavicular joint, sternoclavicular joint, scapulothoracic joint, and glenohumeral joint. So shoulder joint or glenohumeral joint is a part of shoulder girdle, and shoulder girdle is not shoulder joint. So this is the doubt of most of the students. They get confused. And coming on to the surfaces of the joint, the proximal surface is formed by glenoid cavity of scapula. It is shallow, and the surface area, by the look from the diagram, you can see that the surface area of the glenoid cavity is smaller than the surface area of the head of the humerus. So they are little bit incongruent, or we can say God has provided more mobility than stability here. Since there is another joint in our body, that is ball and socket joint, which is hip joint. Hip joint has acetabular fossa. It is much more deeper than glenoid cavity, and it provides more stability than mobility. So we need mobility at the shoulder joint. For stability, there are some tissues that provide a little bit of stability too. That is glenoid labrum. So what is glenoid labrum? It is a soft tissue extension at the periphery of the glenoid cavity. So it deepens the glenoid cavity, and it also provides the suctioning force to the head of the humerus and provides stability. So the second structure that provides stability is the fibrous capsule. The fibrous capsule surrounds the joint. Fibrous capsule is in every joint. So the fibrous capsule is reinforced further by ligaments. These are the coracohumeral ligament. This is the coracohumeral ligament from coracoid process to the humerus. Then we have three ligaments that provide stability in different positions of the arm, that is superior glenohumeral ligament. This is superior glenohumeral ligament. Then we have middle glenohumeral ligament. Then we have inferior glenohumeral ligament. These three ligaments become taut in different position. For example, when my arm is hanging by the side of my body, the superior glenohumeral ligament will be taut, but when I raise it up to here, the middle glenohumeral ligament will become taut. Then when I raise up to 90 degree or I externally rotate my arms, then the inferior glenohumeral ligament will be taut, and the other two will be lax. So these provide static stability. These are the static stabilizers of the shoulder. So now we will talk about the different movements that can be produced at shoulder joint and the muscles that are responsible for that movement. So the first movement is flexion. So flexion is produced by the anterior fibers of deltoid muscle, the coracobrachialis, and a part of pectoralis major muscle also produces flexion. Other than that, serratus anterior indirectly moves the scapula to further increase the range of motion of the shoulder flexion. And the second movement is extension. So extension is like this. to produce extension movement, the posterior fibers of the deltoid muscle work along with teres major muscle and latissimus dorsi. Talking about our next movement, that is abduction. Abduction is like this. So abduction is produced by firstly the supraspinatus muscle lifts the arm up to 15 degrees. Then the angle of the deltoid becomes appropriate to lift up the arm up to 90 degrees. Then the trapezius and the serratus muscle rotates the scapula so that the range of motion of the uh, glenohumeral joint can be completed. So what basically happens is for the first 15 degrees supraspinatus will work, then the deltoid begins to work. Along with that, the trapezius muscle and serratus anterior muscle externally rotate the scapula all along to complete the range of motion. So talking about adduction movement is like this, moving towards the body. Abduction was moving away from the body. So in during adduction, our latissimus dorsi muscles are lower part of pectoralis major muscle and teres major and teres minor muscle works to produce adduction. So the next movement is medial rotation. We can do medial rotation either like this or like this. So medial rotation movement is produced by teres major, subscapularis, pectoralis major muscle, anterior part of deltoid. So these muscles produce this movement. External rotation. So external rotation is like this. We can call it external rotation or lateral rotation or like this. So to produce this movement, the infraspinatus muscle, teres minor muscle and posterior part of the deltoid helps in production of this movement. So the last movement is circumduction. Circumduction is combination of flexion, extension, abduction and adduction. That's it for today. The further information on the shoulder joint will be provided in the next video. I hope you understood this video. So please like, share, comment, subscribe and press the bell icon. Thank you.